Do you find that you have a lot of tension between your shoulder blades after breast cancer surgery? Maybe that tension in the mid-back is working its way up to your neck area. There's a lot that happens with our whole chest area with surgery, and the mid-back area is a really common place for compensations to show up. This video covers 5 things that you can start doing to address this mid-back pain. This is actually what I did after having mid-back pain after a double mastectomy. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. Let's first go through what causes all of this tension in our mid-backs. Guarding and compensations. After surgery, our body's tendency is just to roll forwards, and that's just to serve sort of to protect that area. So this happens mostly with shoulders going forward, but it can also be combined with head jutting forward as well. I found that I had much more guarding with my mastectomy surgery as compared to my exchange surgery, which was tissue expanders to implants. Limited sleeping positions. With a mastectomy, you'll be avoiding lying on your stomach for a while and also lying on your side when you have your drains in. If you had a one-sided mastectomy, then you can, of course, lie on the unaffected side. In general, you'll be spending a lot of your time on your back sleeping without much variety in changing positions, and this adds up in the body. Too much time spent in one position. Similar to limited sleeping positions, there'll also be limited resting positions for the initial stages after your mastectomy. So we tend to be sitting a bit more than usual. Less movement in general. Most of us are likely not moving our bodies as much as we were pre-surgery for those initial stages after your mastectomy. And bodies really do need movement to be functioning in a pain-free state. Tissue expanders. It's really common to have mid-back pain going through the tissue expansion process. These are the 5 things that help the most, and hopefully some of these strategies will help you if you are experiencing mid-back pain. The first thing is to resume regular, everyday movements as soon as possible after surgery, or at least within the first week. This doesn't mean go and do some laundry, chop up some vegetables, or vacuum. I'm talking about easier everyday things like dressing yourself, brushing your teeth, combing your hair, putting things away, very light food prep. So just very light tasks at home. Because I had tissue expanders and then implants placed under the muscle, I found that sweeping and even that action of wiping a counter felt really sort of weird and uncomfortable for quite a few weeks after surgery. Remember, one of the contributing factors to mid-back pain is guarding. Doing these everyday movements helps to teach your body that these movements are safe, you don't need to avoid them, and you also don't need to guard your body while you're doing them. The second thing that you can start doing after mastectomy is walking. This will bring blood flow to all the muscles that need it, so your neck, your mid-back, your shoulders, and your chest. When you're walking, try to ensure that your arms are swinging. There's less movement of the upper body and shoulders when you're hanging onto some sort of purse on one side. So if you can, use a mini backpack or a fanny pack if you want to bring something with you when you're going for a walk. You may need some help getting that backpack on for the initial stages after your mastectomy though. Rehab exercises. I've done a separate set of videos on the rehab exercises to do after breast cancer surgery for the various stages, so I'll link to that in the description below. But I've chosen a few that will be the most helpful for addressing mid-back pain. Moving and activating muscles like your mid-back area helps to relieve tension in those muscles. Resting tight muscles to try to reduce pain generally has the opposite effect. First exercise is a row. You can start by grasping a band with your arms straight out in front of you. Draw back your elbows and continue to pull the band until the inside of your wrists meet your rib cage. Slowly release the band back to the start and then repeat about 10 times. Try to initiate the movement for each rep with the muscles between your shoulder blades. So you should feel your shoulder blades squeezing together throughout this exercise. If you're doing this exercise before the 3-week mark after surgery, I would do this exercise without the band. The second exercise is shoulder external rotations. This is done either with straight arms or a bent arm variation. For straight arms, you're going to start with your arms relaxed at your side. Keeping your arms straight, rotate them outwards so that your thumbs point back. Think of squeezing the muscles between your shoulder blades as you rotate your arms back. Return to the start position and repeat about 10 times. For the bent arm variation, you can start with your elbows at 90 degrees and with your arms at your side with your palms facing inward. Rotate your arm outwards, squeezing between your lower shoulder blades and back of the shoulders. Repeat about 10 times. The third exercise is neck rotations. You can start by bringing your chin down to your chest, rotate ear to your shoulder, around to the back, ear to your other shoulder, and then back down to the front. And you can repeat this in the other direction and then about 5 to 10 times. Even though this exercise isn't directly focused on the mid-back, better neck mobility will help improve mid-back pain and reduce compensations in that area. The fourth exercise is thoracic rotations. Start on your hands and knees and place one hand behind your head. Rotate your body so the bent elbow touches the inner arm that's on the ground. Then leading with your elbow, rotate in the opposite direction as far as you can go and hold about 5 seconds. Think about activating the muscles between your shoulder blades as you draw the elbow back. If you found this video helpful so far, hit that like button below to let me know. I found that getting onto a foam roller in the first number of weeks after surgery was very awkward, so it didn't work for me. I ended up using a lacrosse ball. You could also use a tennis ball against the wall, and this was much easier. To roll out the mid-back, place a ball to the right or the left of the spine and then lean your weight into the ball. You can move your body up and down a few inches at a time and then move the ball lower to release a new section. Ball rolling will help improve blood flow to the area and also give the sensation that your muscles are much looser. This in of itself won't make for long-lasting changes, but if you pair this with the strengthening exercises and stretching, you will see more benefit. You may notice after rolling that there's a bit more of an ease of tension in your mid-back, and that will make assuming a better posture a little bit easier. And then again, the strengthening exercises will help to reinforce this new posture. What area should you be rolling? You can start out where the ball goes to the highest point without it rolling out. So that's usually somewhere in that upper back area. And then you're gonna go down to about bra line area, just below that. It's important to roll not just where you hurt, but going above and below that, because some of those areas of tension can sort of feed into that area where you're uncomfortable. The last tip is getting some treatment. This is probably one of the most helpful things that I did, but I don't think it would have been as effective had I not been doing all the other self-care tools that I mentioned before. I started getting treatment from one of my colleagues about a week after my mastectomy, and this was just to some of the surrounding areas, so not on my chest, but in through the mid-back, neck, and the shoulder area. After getting treatment, I realized how much of the discomfort that I was feeling was more due to guarding and not the actual surgery. Because of the work that I do with patients, I was well aware of guarding, but even knowing this, I still did this unconsciously and tightened up. So in general, a lot of the compensation type of pain that we experience after breast cancer surgery can often be addressed with treatment. I purposely put treatment at the end so that you can try all the other self-care tools first, but if things aren't moving in the right direction, it would be worth looking into. What type of treatment would be best? Any form of manual or hands-on treatment. You can see a chiropractor, a physiotherapist, or a massage therapist.